I'm Emmanuel AbaraE, community urologist from the Northern University. I'm glad to present on behalf of my colleague, Dr. Andrew Evans, Johnny with congenital urinary malformations and renal cell carcinoma. We have no conflict of interest. These are my disclosures. Congenital urinary malformation presents early in life. Primary megaurethra, obstructive and non-obstructive, can be rare. Early childhood recurrent UTIs, incontinence, and unexplained fever, and in adults, chronic abdominal pain, recurrent bladder infections can be also presenting. Our objective is to present our case and learn some lessons. Rare association of megaureters and urethrocyst with renal cell carcinoma. These involve complex surgery, decision-making, patient autonomy, healthcare professionalism. We also note that advancing technology, telemedicine have been impactful in patient surveillance, particularly in rural and remote communities. This is our case. 35-year-old lady presented to emerge with 5-year history of multiple visits, abdominal pain, recurring UTIs, sweating, and fevers. Patient insisted for more tests and referral to a specialist. Ultrasound and IVP showed bilateral megaureters and bilateral urethrocysts, decompensated bladder, therefore referred to urology. Following assessment and explanation of options, she had bilateral tapering and reimplantation of the ureter with excision of bilateral urethrocysts. She did well post-operatively and was placed on surveillance with urinalysis, interval ultrasound and IVP through the family doctor. 14 years later, she presented with asymptomatic persistent microscopic hematuria, and an ultrasound, CT scan, and MRI scan showed the right renal mass suspicious for cancer. Patient insisted to have her previous urologist look after her. She required exploration, radical right nephrectomy for papillary renal cell carcinoma. 17 years later, she is well, living with a functioning left kidney, free of infection, has normal blood pressure, and is happy. These are CT scan and MRI images, and this is the pathology slide showing the microscopy. She has had surveillance by telemedicine, Northern Specialist Visiting Program, and digital diagnostic relay of results, and has done well. Take-home messages include rarity of malignancy with rare congenital malformation. Found in adulthood, reconstructive surgery can be challenging but rewarding when successful. Successful collaboration among healthcare professionals is important. Advances in technology shaped accurate diagnosis, prompt appropriate care, and successful surveillance program over the years. Future considerations include encouraging patients to share their stories for our education, for transformational purposes. This may be transformational, bringing healthcare professionals closer to their patients. Thank you very much. These are my references.